rapid test for COVID, antibody, active virus, as well as flu, strep, RSV if someone's exhibiting symptoms, and we vaccinate.
And tell me, I mean, the process only took minutes.
That's right.
Just a few minutes to go through, no problem. Why would someone want to access point-of-care health services? I'm thinking like youth volleyball tournaments.
You bet.
Where you got a bunch of people you need to test before the tournament.
We don't want events to be canceled and people to not be able to go to work. So organizations, employers, churches, institutions, anywhere where people would be congregating and we want them to be able to live their lives, can test in a matter of minutes and know if it's safe to move on and keep working.
Still a lot of rules and guidelines for these events, and this a lot of peace of mind and just get people through fast.
Absolutely.
Is this your only unit?
We have another one and then more in production. So ramping up to a fleet.
Who's this behind you?
This is Bobby, our COO.
Hey Bobby, how are you?
Hello, I'm great. How are you?
Great. Tell us about this and why it's so important for the community.
It's very important to get employees back to work, get the economy going again, and also just ease concerns, you know?
Yeah.
It's taxing on employees when they have to leave work and go get tested at various different sites. Sometimes it's hard to get appointments.
It's expensive.
And it's expensive, yeah. And it costs not only, employers time because they're having to let them go, but then also,
And some people could pay cash, but also insurance. And
we accept insurance to lower that cost burden, but people could self-pay if they needed to.
And if somebody wants to, let's say we have an event coming up weeks, months from now, they need to get on a schedule and get you guys going, right?
They can do that on our website. They can book this mobile unit with blocks of hours or for a full day or multiple days, all through the website.
That is awesome. And who's the doctor working with you?
Dr. Wilford.
Dr. Wilford? Dr. Wilford here with us as well with Point of Care. Tell us about how important this is for the community.
Well, as they were saying, we're trying to get everybody back to normal. And I think that's what everybody wants to do. The governor wants to do, everybody wants to do, is to get people back to normal. And this is how we want to help do that. Just one point is how this test that you just got is the best test that there is that's available.
Tell me about the variety of tests they're doing.
Well, what you had to test for the presence of COVID, there are two kinds. There's an antigen test, which is what these mobile units are in parking lots and places like that.
Right.
They're not of much value in asymptomatic people. If you're sick, they're okay. But if you're not sick, they're not much value. What you had is a PCR, which is the very best test for asymptomatic people, as well as symptomatic. But for asymptomatic, it's the best test. And the problem has been that there hadn't been a rapid test. It takes 24, 48 hours, so it makes it more difficult. This is going to be 15 to 30 minutes.
Right.
So as you all were discussing, getting people back into events, back to work, back whatever, this is going to be a huge
Will
breakthrough.
it tell me if I have already had the virus?
The second test you had is an antibody test.
Right.
And that will tell you if you've either been vaccinated or had the virus.
And could have had the virus, well, I guess a year ago.
And been asymptomatic. And then the other thing that we can do is, if, let's say you're an employee and you just don't feel very good. That doesn't necessarily mean you got COVID. You could have the flu, you could have strep, you could have all kinds
seasonal
of
allergies.
And we can test for all that stuff.
Right.
And so if you're the employer, you then know, hey, this guy, this person doesn't have COVID. We don't have to quarantine for 2 weeks. They just got the crud. They stay home for a couple of days and they're back at work.
Well, this is a great effort. This is a great concept, little peace of mind, and just the speed and the volume in which they can test people.
That's what's going to be great, yeah. So, and with the mobile unit, we're available to go anywhere, anytime. And as Wendy said, go to the website, take a look at it, and then give us a shout.
There you go. Doctor, thank you very much.
Thank you.